The goal for us is to eliminate awareness as an end goal of public health campaigns. We developed the term awareness culture, and awareness culture is basically when, all of the walks, all of the observances, all of the shopping create more awareness, but really nothing else. So it's like this ever increasing bubble that really doesn't amount to any behavioral change in a lot of cases, or in education in a lot of cases.
Again, awareness doesn't translate into action. That's what we hear, right? Those are the models, hierarchical effects. Action leads to involvement, leads to awareness, leads to involvement, leads to desire, leads to action. We think that awareness will build into something. And what our research shows is that it doesn't.
Awareness culture is culture where awareness is considered a panacea for all problems. And what it generates things are, and some of it's good, like social support is fine. But observance days, the month days, donations, events, cause marketing, shopping, and they perpetuate. So the next walk, the walk you do now is probably paying for the next walk or half of that walk. As far as professionals, some of the things that we might tell them would be to take the current mission statements and rewrite them so that awareness is not the ultimate goal of the campaign. Perhaps the goal is risk reduction or education, for example.